Good day, and thank you for joining us for this panel discussion with our friends from the Council for Federal Cannabis Regulation. Today, we're discussing intoxicating hemp-derived cannabinoids. Before we begin, we need to cover a few housekeeping items. If you have any questions during the webcast, you can submit them through the Q&A widget at the bottom of your screen. We strongly encourage audience questions, and we will do our best to get all of them before the hour runs out. Your questions will only be seen by the presenters. You can also find some common answers to some common technical issues located in the help widget at the bottom of your screen. And with that out of the way, I'm Jack Jacobson, and I'm an advisor at Thompson Coburn, and I'm one of the Council for Federal Cannabis Regulations advisors. To start us off today, I'd like to welcome the new Executive Director of CFCR, Chris Michelle. Chris?
Hello, good afternoon, everyone. Thank you so much for joining us in our esteemed panel. We are so excited to be talking about this very important subject. I am currently down at the Broadmoor Hotel at NOCO, which is talking about this very subject. So we are right on target, and I would like to introduce you to our wonderful panel. Kay Doyle, the Director of Government Affairs for Green Thumb Industries, Dr. Jillian Schauer, the Executive Director for CANRA, Christian Sederberg with Vicente LLP and VS Strategies, and Michael Brownstein of ATTACH, the American Trade Association of Cannabis and Hemp. So thanks so much for joining us today. And we'd like to get started. We only have an hour, so we're going to jump right in with Kay. And Kay has quite a bit of experience and would like to kind of start with the question of what role the public education campaign plays as policymakers continue to consider how addressing to intoxicating hemp products. So can you start us off with that?
Sure, Chris, and thank you for having us all here to talk about this important subject. Just to level set for everyone, we're now 4+ years out from the passage of the 2018 Farm Bill. And just recently, the FDA has announced that it does not feel that CBD can be regulated as part of the dietary supplement or food regulation structure at the FDA, which certainly signals what would be the case for intoxicating hemp cannabinoids. So it's a different situation than what we faced when I was serving as Massachusetts Cannabis Control Commissioner, where we're starting from the authorization of the distribution of a system and setting up a comprehensive regulatory structure to do that. FDA has instead said that what they would like to do is go back to Congress and pursue a cross-agency strategy for the regulation of these products to protect the public's health and safety. And when we were starting out in Massachusetts looking at regulating the adult use cannabis industry, one of the things we did was go and speak to veteran states like Colorado, Washington, and California and Oregon about what they did to make sure that the industry could be launched safely with the public's health and safety in mind. And one of the first things that they told us is to get a public education campaign together as one of the first priorities. And I know the other panelists can speak to this as well, but one of the things that is disturbing if you talk to a member of the public about intoxicating hemp cannabinoids is the lack of education, the lack of understanding with what these products are. They have some awareness that they have been legalized to some extent, but certainly no awareness of what the level of regulation is, which is understandable when we're looking at, yet again, a federal and state dichotomy of how the substances are being treated. So I think one of the things that we have to look at as we look to the federal approach of going back to Congress and then the states trying to fill in the gaps is what can we do to help the public understand the situation, peculiar as it is, and what they can do to protect and educate themselves.
Thank you for that. That's wonderful. And that kind of leads us into what Jillian, Dr. Shower's been working on with the Cannabis Regulators Association. And we've got a few things that from a state regulatory perspective, what are the major concerns with the intoxicating hemp-derived products that have proliferated online as well as in several states?
Yeah, I think anyone who's heard me talk about this topic has heard me talk about consumer safety first and foremost. I think that's a huge challenge, and all of the state regulators that I'm privileged to know and work with have that at the forefront of their work. And because we are lacking appropriate federal regulations for hemp-derived cannabinoid products, there's a big consumer safety gap. So there's no federal requirement for labeling, including to list the amount of THC that might be in a product. I think consumers have confusion about what hemp means and what's in hemp, and the labels are not helping them understand that. There are no required warning labels. There's no required federal testing. These are all things in the regulated cannabis market for medical or adult use that we have in place with the primary goal of protecting consumers. So consumer safety is one of the biggest challenges that regulators face in this space, and trying to figure out how best to protect consumers with this new avenue through which we're seeing cannabinoid products. Youth access is another one, and I think our regulated adult use and medical use markets have been very successful at preventing access by youth. Compliance with adult-only sales is extremely high. It looks different in the cannabinoid hemp-derived marketplace. These products are available, in almost every location that we all frequent. They're available online. You don't have to do much more than click that you're over 21 to be able to purchase them and have a credit card, and they can be shipped to you. So the youth access piece is another challenge, a space where cannabis regulators have really had a focus and I think done well. And we need that focus in the hemp-derived product space. Then the last point I typically make in terms of challenges is if you believe that the regulated marketplace is inherently safer for consumers and for public health, which I personally believe, this is the biggest challenge I think we've seen to the regulated marketplace. These products are unregulated federally in the final product form. They are sold everywhere. They have banking access in general. They have no tax applied, and they, do not have the level of regulations that we see in the medical and cannabis use markets. And adult use and medical cannabis regulations have largely been put in place to protect consumers. So I think this is the biggest threat to the regulated market experiment that we've seen. And the last thing I'll make on the challenges box is with regard to legislation. I think this is an extremely challenging topic to legislate. It's very scientific, as you'll quickly hear on my next response. I'm going to get deep into some of the science. And that can be difficult for lawmakers that have a lot of things on their plate, especially with everything going on now. They may have cannabis in a portfolio of dozens of other things, and this quickly gets extremely scientific, which can make it difficult for folks to know kind of where to draw the line. So I think there are a lot of challenges that regulators are thinking about and trying to address.
Thank you so much. And so, Kristen, that leads us into the little bit of criticism and concern that—
Chris, sorry, can I jump in and talk about best practices? Is that okay?
Of course, of course.
Okay. I wanted to bookend the discussion about challenges by talking about best practices. So I think we're far from having best practices at the state level. But I do think there have been some trends. I think it's too early to know from a regulatory standpoint what is working and what isn't. But we did see a couple years ago a first round of states that brought regulatory authority for some of these impairing hemp-derived products under the cannabis regulator to instill things like lab testing requirements, to work on packaging and labeling standards, not necessarily to apply the exact same regulatory pathway, but to apply some regulation, given that these are the agencies at the state level that really have been regulating finished products with cannabinoids. So we saw that a couple years ago. And then last year, it was a really interesting legislative session. We did not see nearly as much of that. We saw a trend towards task forces, where task forces were being recommended by legislatures to talk about these extremely scientific issues. And several states have them: Washington, Oregon, Colorado, Virginia, to name some. Christian's going to talk much more about Colorado's task force. But I think in general, what we saw from the task forces is that they struggled with the same issues that regulators and legislatures were. And there were not easy answers to these issues either. So just to name a few, a few of the big kind of regulatory questions that I think are out there. How do you define impairing? This is not an easy question. There have been some extremely scientific definitions that have been proposed in legislative discussions, binding affinity to the CB1 receptor, meeting the tetrad test, things that get very scientific to legislate on and also to implement. Those are not easy things to implement. I think, Oregon did some work to suggest that we could borrow from alcohol and we could look at a level at which almost no one would be impaired and sort of set a low end threshold. We could use the dictionary definition. I mean, we could probably spend a couple years talking about what impairing and intoxicating means. And across all substances, we don't have very clean frameworks set out in general. So I think that's been a difficult question to try to legislate on. The next one is what to do with full spectrum products. So there's a lot of discussion about how some of the policies that have been proposed would eliminate full spectrum products. Full spectrum products are products that have had the entire extract from the plant pulled out of the plant, including the THC. So you've not taken away the THC, you're trying to replicate the cannabinoid profile as it is in the plant. But when you extract that and concentrate it, you can end up with products that do have a lot of THC in them. So some of the things that have been proposed through task forces, and hopefully Christian will talk more about this, and also in legislation are ratios, a 15-to-1 ratio, a 25-to-1 ratio of THC to CBD, or CBD to THC rather. These are not based on science. We don't have science to suggest what the right ratio would be. And in fact, what we see from the science is really a mix of studies. Some that say that having CBD in a THC product can attenuate the THC and can make it less likely to cause impairment, and others that say that it does the opposite. There was just a study published in a really reputable academic journal that suggested that actually when you have CBD in high amounts present with THC, the THC seemed to be potentiated. That meant that people felt a higher high in those instances. So we're lacking really clear science to help guide some of those thresholds that are being talked about legislatively. And I think in general, there's still a discussion about the fact that a serving size is likely still needed. Even if you had a ratio of 15-to-1 or 25-to-1, you could still create products that would have a lot of THC. There's also, this lack of consumer awareness and lack of labeling on the products. So full spectrum products right now don't have to tell you how much THC is in them, which can make it difficult for consumers to know what they're consuming and what the effects would be. And then the last really big policy question that I think is a challenge to legislatures and regulators is what to do with synthetic, semi-synthetic, and biosynthetic products. The safety and regulatory pathway for those has not been well laid out. Those are products for which we would usually have FDA involved in setting a regulatory pathway that would assure consumer safety. And many states are not resourced to set up those rigorous pathways to try to regulate those products. You can make environmental and economic arguments, I think, on both sides of the issue, but that's another challenging sort of definitional area. So in our work at CANRA, what we focused on doing is facilitating discussions across states to try to learn from what's happening on the ground. We've brought in experts to talk about the issues. We have brought in different trade associations, from natural products and dietary supplements to hemp to cannabis, to share information directly with regulators about what their policy positions are and why they have those policy positions. And then we've created some fact sheets, some really basic fact sheets about what is hemp, what are the regulatory challenges on the ground. And these fact sheets have been created for lawmakers to help them maybe simplify what can be a very complex and scientific topic. So we're doing as much as we can, but this is definitely a challenging space.
Well, that is, as you said, the education is so important, and the expertise that people have in this. And Christian, you're not only an expert here in Colorado, but maybe you can speak to us a little bit about the concerns regarding the makeup of the task force that is largely included industry participants on both hemp and the medical and adult use cannabis side. And with the lack of independent voices without ongoing financial interest, do you have any thoughts about that?
Sure, and it's good to follow Jillian on this. And by the way, thanks for having me. It's great to be here. But Jillian just raised a bunch of issues about the various challenges, the legal definitions, the science challenges. And in Colorado, we have a long history of putting together working groups or task forces around cannabis issues, starting with the Amendment 64 task force, which I was a member of back in 2012, 2013, after Amendment 64, which legalized adult use cannabis in Colorado. That implementation process included a very robust stakeholdering process, which was called a task force. That task force included a lot of non-interested parties, meaning a lot of government officials, state and local, but also law enforcement and activists on both sides of the issue. In fact, I think when I counted it up back then, there was about 5 people that openly supported cannabis legalization, and the other 20 or so were either on the record opposing it or neutral to opposing. So we took that forward here, and again, I think we got to a lot of good good results and things that we made recommendations on. But it's important to raise this kind of elephant in the room, which is that the task force this time on intoxicating hemp was made up of kind of a 50-50 split, with a few exceptions, but a real split down the middle of people that had financial interests in the outcome, either to broaden or keep the current allowances for the sale of various intoxicating products derived from hemp. And then also people on the cannabis industry side, adult use and medical, that are state licensed businesses operating adult use cannabis and adult use and medical cannabis businesses that have been operating for over a decade here. So again, perception is reality. So I had concerns, and I raised at many times during the course of the task force and saying, look, I'm one of them. Our firm represents clients, both hemp clients that have hemp, operations, but also cannabis clients. We kind of fit in the middle. And I think at one point, one of the speakers said in an interview, that they couldn't really tell which side I was on. They were describing the task force. I said, there's Christian Cederberg, and he's no one really knows what he's doing, which is kind of where I wanted to be. But I do think that for the most part, people really came together to make recommendations, trying to focus on what Jillian mentioned, which she said consumer safety, but also, really public health and safety writ large. Consumer safety being a huge one, but also how do we make sure, these products, people know what they're getting, but also that they're not getting into the hands of kids or, people underage. So, again, I don't want to be too critical of what happened, but definitely I think we left something to be desired in terms of our process, just by having such a heavy, hemp industry and marijuana industry representation. Again, at the same time, a lot of folks came in and they were, two sides, staring across the vast gap between the conference room tables at each other. And by the end of it, I actually think a lot of people, like, new relationships were made, good relationships were made. People understand better where the other side is coming from. But, again, we got to be credible here. We need more CANRA type folks or state regulators. And our state regulators, by the way, were involved in the process. They definitely helped. I don't want to take away from their organization of it, but they were, just 1 or 2 voices out of 15 or 20. So, but going forward, having, groups like CANRA or just state regulators, and also the FDA getting engaged to really drill down on some of these incredibly complex issues. This was like the biggest onion peeling exercise of all time. I think we did over 100 hours of meetings, and then there was a ton of work besides that to come up with our state recommendations. And those are just recommendations this task force made. That all this is available publicly, by the way, but we made that to basically the legislature. And so we are going to see a bill in the Colorado legislature, which has about a month left, which is not much time, and an incredibly comprehensive and, confusing in some parts, but getting better bill that should be introduced next week. So this isn't a done deal. The Colorado recommendations could change. I'm sort of the opinion that, for the most part, stick with those recommendations unless there's issues that come up that, should be decided by public policymakers. But otherwise, stick with the recommendations. And obviously, I'm happy to get into the recommendations more as we have this conversation, but I don't want to take too much time. Just wanted to lay out sort of what happened in Colorado in the process, but I'm sure we'll get into some of the more, nitty gritty details as we go on here.
Christian, can I ask, do you think a task force is the right way to go about policy making for this? I mean, what were some of the pros and cons of it? And is there a better way? We saw so many states do this. I think it's probably being talked about federally with the Farm Bill on the table, but is a task force really any more effective than the legislative debates that happen?
Yeah, that's one of those, and I'd love to, other people might have ideas here too. Obviously, task force, like the reason why this became a task force was because it was a defensive mechanism, honestly, for folks in the hemp industry to sort of say, let's kick the can down the road a little bit. And again, not taking away from their desire to get to good public policy and, have more open discussions. But part of it is, it could be if the policy, if the task force, justification results in kicking the can too far down the road, or just saying, great, now we don't have to deal with it. The problem with a lot of this, and the reason why we have these task forces, is because of the lack of work being done, particularly at the federal level. And so there are concerns that task forces going forward, although they can bring up an issue spot, and it's not surprising at all, but all these task forces are really kind of landing on these same big picture issues. I think it's kind of run its course at this point. I always think stakeholdering when it comes to state legislation in particular is incredibly important. When you get to the federal level and you're talking about a task force that would then affect the entire nationwide industry, or nationwide industries, I should say. I don't know how that, I don't know how effective that would be. And a lot of people are critical of historically task forces or working groups that the federal government, puts together, because that's one strategy of kicking the can down the road. So I think we need maybe, working groups and people that are really smart, especially on the science, that are validated to be in the room and be trusted advisors to whatever this looks like. But at the end of the day, a task force that has, good lobbyists who can get their people on those task forces, or, other things, it can be effective, or it can just be the deepest rabbit hole that some of us have gone down in years.
Yeah, thanks.
Thank you. And that kind of leads us to, a state legal markets. And Michael, I'd like to see with the American Trade Association of Cannabis and Hemp, you see this on both sides. And from an industry perspective, how does IHDC challenge the current regulatory structure of those state legal markets?
Yes, thank you for the question. And also thank you for having me here, and for the Council for Federal Cannabis Regulations work throughout this process, and the dialogue that we're having here today. In listening to the conversation, I mean, even some of the things with the task force, task force is generally used for a problem that nobody understands, and it generally provides solutions that nobody likes. And I think that some of the things that we've seen here really are complicated. It's a complicated issue, but I think that when we distill what the regulatory infrastructure looks like, both at the federal and the state level, there is a large guiding principle that has always guided us relative to both the cannabis and hemp market, and has guided both regulation, but I think has also guided consumers in the marketplace, and that is whether a product is intoxicating or not. And we generally, the guidepost for regulation is always, well, does a product fit into an intoxicating category, right? And that was sort of the whole idea at the federal level, and drawing a line, and there is the line that's drawn right now. There is no line. That's the problem. At the federal level, we have definitions where you could create Delta 9 THC that is both completely legal by some accounts under the federal farm bill, and completely illegal under federal law, all at the same time. And so the actual regulatory confusion at the federal level is stopping not only the production of lawful intoxicants, but at the same time, it's proliferating an entirely lightly to unregulated marketplace. And when we started off in campaigning, and Christian here, who was heavily involved, the principal person involved in the Colorado campaign, it was to tax and regulate. It was to tax and regulate. It wasn't to untax and unregulate, and it was to regulate like alcohol, which we deal with from a level of intoxication. So if that's the guidepost, I think that leads you to clearer regulatory answers. And what we've seen in the federal farm bill is that and where people are coming at the from where the federal farm bill is that really what was trying to be drawn was a line. And we spent a lot of time advocating around the federal farm bill the first time around on the hemp industry. And I just remember thinking at the time and saying to people at the time that, look, and we didn't know about the proliferation of the intoxicating hemp derived cannabinoid market, but we did know that it was likely to, we did know that it was likely to be able to produce levels or at least legal inconsistencies around some issues that we were going to see in the market. And look, public health and safety, consumer protection, and rule of law are the standard things that, from an industry perspective, we need to be talking about, regardless of what line you want to see or where it is. We can't have consumer confusion. We can't have people show up and have products that are unregulated that they can buy through several channels that are unregulated and not know what are in those products. Not have age gating, or people being able to buy intoxicating products without the level of age restriction, without testing. These are the types of things that consumers should demand, and these are, quite frankly, the types of things that industry should be talking about now. Too. And in these corners, we need to do what we did to make sure that products are under regulation. And I would also say this, that it's when we talk about intoxicating products, we also have to have a conversation about non-intoxicating products, because they're important products too that are on the marketplace, and they are the different side of the same coin that deserve a regulatory pathway and merit additional scientific discussion and discovery relative to products. There's a usefulness to this. So if we move to a place, and I've said this on a number of occasions, but we need to move to a place where we are regulating by product. We are looking at the finished product. We're looking at how it's marketed. We're looking at how it's labeled. We're looking at who it's going to and what purpose people say that it's going to. You tell me what that product is. I can show you how to regulate it. And I think a lot of people here would agree to that. But make no question, this is the biggest question of our time relative to how we move forward on cannabis regulation. And this farm bill, to which there will be a before and after, and where these lines are discussed, where these lines are drawn, and how regulatory infrastructure exists afterwards is going to either create additional challenges or additional opportunities. So we have to be very careful about how we advocate. And my view would be public health and consumer protection is needed greatly here, and that's where we're coming from.
Yep, Michael, well said on all fronts. And just want to jump in quickly and just highlight a couple things you said, but also, not many people know this, but Amendment 64 actually didn't just legalize recreational or adult use marijuana in Colorado. What it did was it legalized hemp. And we wrote it into the law because we knew how little people knew at the time that, everyone at the time kind of said hemp's marijuana. They kind of lumped it together. There's actually a thing called a single subject rule. We actually didn't think that the state would accept us legalizing both recreational cannabis and hemp at the same time, because we know they're different things. But they didn't figure that out. And so Amendment 64 also became, created, really is the momentum behind this. But those things have to be read together, which is there was clearly intoxicating and non-intoxicating intent around, adult use marijuana and hemp. So Michael, your points about, what is the kind of minor star on this? It's like there's two lanes. There's intoxicating products and there's non-intoxicating products. And that doesn't mean that stuff that is non-intoxicating products, if used off, if you eat or drink a bunch of several things that are totally legal in the regular world market, you know, those things can be intoxicating. So we're kind of approaching it from the spirit, the North Star, you know, creating two lanes. But I just think I think it's really important for people to understand some of that history because, you know, basically hemp has become, and intoxicating hemp is the result in many ways of the success of the cannabis programs. Back in 2010, when we first regulated medical marijuana, we would do meetups with patients and you know, little old ladies, literally, and people that were caregivers. We do it, you know, it would happen at churches and libraries because we thought that was the lowest likelihood of the cops kicking the door down, right? Fast forward a few years, we legalized marijuana. We got the federal government, including under the Obama administration, shutting down 51 dispensaries in Colorado that were too close to schools, basically saying, we're not going to kick your doors down, but if you don't close in 30 days, we will kick your doors down. To a few years later, where it's just really not a priority. And people have kind of said, look, it's happening. We don't want to prioritize it, but that's allowed a proliferation of, you know, all the marijuana, all the cannabis adult use medical people are really focused on state only markets, no diversion out of state. We can't do online. Like, it's just not in our you know, DNA on this to do anything that's like international, national. Obviously we push for that from a legislative perspective, but because of the sort of reduced focus on the sky is going to fall, marijuana is going to ruin, you know, kids, ruin the world. Because of that success, I think it's created this gap for, you know, this nationwide intoxicating hemp market where you're seeing products that are sold literally exactly identical to products that are sold to intoxicate people. 10 milligrams of isolated Delta-9 THC, but it was derived from hemp, and the gummy bear only weighs 5 grams, so we can have 15 milligrams of THC. That's the argument, but there's no enforcement. So anyways, hopefully that, I know I've kind of jumped around a little bit there, but I think that's where the sort of angst, frustration comes from the industry, marijuana industry side, saying this doesn't seem super fair, but we don't want to shut down people's access to these full spectrum hemp products. We want there to be a robust hemp industry. At some point here, we're all got to get together anyways, because we should be friends, not enemies, you know, even if, you know, for the time being, we have some policy differences. So sorry for being so long-winded there.
No, not at all. That's helpful, Christian. Michael, you know, when you think about the finished product reality, I'd love to hear more about that, because I think one of the challenges that states have seen is that there are two regulatory pathways for what Christian just articulated can be effectively the same product. And so I would think we want to avoid that federally. We want to avoid having a regulatory pathway for hemp over here and for cannabis over here, you know, someday, one day, because then you end up with the same problem that states are facing, where it's extremely challenging to have two different bodies have the same regulatory oversight. And, you know, one maybe have more regulatory oversight than another in the case of cannabis versus hemp. So I'd love to hear your thoughts in the finished product, you know, reality that you articulated. Where would you see the regulatory pathway? Would it be one, you know, entity that sort of owns that, and then you'd see lots of different regulatory approaches under that entity based on the product? Or are you thinking of something else? I'd love to hear more, because I think that's where we need to go with discussion, is to think about how do we avoid creating the same problems on a macro scale federally as what the states are seeing.
I think that's exactly right, and the question sort of gets to exactly what that regulatory infrastructure should be, and so the modifications on the Farm Bill need to directly address regulation of the product, because the problem is like when you think about marketplace and trying to compete with an illicit market or bring a regulatory structure, you can't have items that are outside the regulatory structure, because what happens is it challenges the very regulatory structure that you have. So federally, the thing that I have said is it may be that people only want to talk about how hemp should be regulated right now, but you can't think about how you're going to regulate from a federal perspective, one without the other, because one has direct implications for the other. So the advice that we have given is to think about this, even if there may not be something that is comprehensively enacted right now. We must concern ourselves with what could be federally, what could happen federally down the line. depending on what it is. So when we've talked about intoxicating products, we want to consider that under the form of what federal legalization looks like. And when we commented on, CAOA or other federal proposals around federal legalization, we have often said that, well, intoxicants should be regulated over by TTB, which has a portfolio of intoxicating products, and non-intoxicating products, which also deal with food and beverage, have pathways around FDA if they're non-intoxicating. But to be clear, we want the primary regulator to be TTB in an adult use setting. So, but I think when you walk back from that, we also have to remember there are a lot of constituencies here. So when we're talking about finished product, we don't want to be criminalizing people who are farming hemp and knowing what they're going through just because that they're doing that. That is legitimate. We need to deal with work in process hemp extract that's not intended for sale to consumer, and be able to deal with that as a thresholding level, whether it's raising that raising that percentage there so that people don't fall under that line, and establishing the federal framework that contemplates eventual federal legalization of intoxicating products and where it might go, even if that's not the thing that's addressed right now. And I think I'll tell you something, for testing standards, labeling contents, a memorandum of understanding at the federal level would do a lot. I think from a regulatory perspective, we've seen an MOU through TTB and FDA on at the federal level as we contemplate what alcohol regulation looks like. We created a model MOU in a circumstance that would look like that. And I mean, we feel that also from enforcement provisions, we need to be consistent about how we do those enforcement provisions. And by the way, these are uncomfortable. These are sort of uncomfortable conversations. When I talk about enforcement, really what I mean is what regular consumer protection would look like in a public health and safety argument provision, right? We don't want to go back to criminalization that we've seen, but we also want to hold ourselves accountable relative to what's in a product. What we say is on the label should be in the product. And what does that mean? That means regulation. Right now, there's so much confusion that there really is no regulation. There's no regulation at the federal level to be able to get something that you want through that is an intoxicating adult use product, and the regulatory pathways for something that's non-intoxicating have kind of been punted from a regulatory perspective. So we need to solve that problem. That's how you solve that problem. You account for everything. Even if it has to be done incrementally, you think about what the end result is and you move towards what that end result is, because that's what public health and safety is going to require here. And that's what we have a responsibility to do.
I have another follow-up, and apologies for my questions. We talk a lot at CANRA about different policy approaches and trying to sort of understand what they would mean. So one of the policy approaches that no state has taken yet, but that has been discussed just to sort of explore what would this mean, what would this do, is regulating by the molecule. Do you, Michael or Christian, do either of you have thoughts on that? I think, some of our discussions at CANRA, it is very difficult in practice and enforcement to actually understand where the cannabinoid came from if you don't have seed to sale tracking. It's, it takes a lot of lab work. And sometimes even then you can't tell, was this synthetically derived or was this, botanically derived if it's been processed in a responsible way and things are removed and byproducts are removed. So there's the challenge of enforcement. On the other hand, we've seen regulating by the molecule with things like bath salts, where then you're just chasing the molecule and trying to figure out, well, how is it changed? And is that on the list that we have or not? Do we need to add it to the list? So I think at CANRA, we've had lots of discussions about, potential pros and cons to the approach. I'm curious what either of you think about that approach as it's coming up in federal discussion.
Michael, I'll jump in quickly, but I think one of the commenters in the Q&A also mentioned this too. One of the biggest thing that's confusing to everybody, consumers and others alike, is this source-based conversation. Like, where did these cannabinoids come from? Did they come from hemp? Did they come from a marijuana plant? We used to have this thing called the source rule, but we've gotten DEA has basically said, okay, now under the Farm Bill, anything, even marijuana plant clippings or marijuana seed, seeds from marijuana plants that will grow up into a, THC, high THC producing plant, that's all hemp now because of the definition that was put in the Farm Bill. And the application of the Farm Bill's definition to 0.3% THC by dry weight to finished products, I think illustrates this whole, illustrates to me the primary challenge or the primary problem that is trying to be solved. Then you peel the onion back and you get into everything you're talking about. But I'm of the opinion personally, but I'm open-minded about it, that at the end of the day, we don't regulate grapes, we regulate wine. We don't regulate grain because it might become alcohol. We regulate it when it becomes alcohol or, it's distilled, those types of things. Now, that doesn't mean we don't look at source products and keep an eye on them to make sure, they're not being misused. So it's not a perfect analogy using grapes and grain, but, we need to, in my opinion, at the end of the day, regulating finished products and regulating what's going to consumers is the most important thing. Now, you mentioned biosynthetics and things like that. There are concerns there. These are where we really need FDA and others, because there's been historical precedent set where something that was supposed to be, a biosynthetic that mirrored a, naturally occurring compound, and we have that left hand, right hand problem where it was a mirror image, and the outcomes for people and pregnant women in particular was horrendous. And so there are, very significant safety issues with taking that molecule approach. But in a perfect world, if we could address those types of issues and solve those, to me, that is the appropriate path for regulation. At least that's where I'm at today. Who knows if that would change? Because I want to hear these other arguments, Jillian, on the other side.
I would say it's a great question. If we wind time back and we were talking about this 15 years ago, and we were thinking about what a comprehensive system would look like, regulation by molecule might be one of those things that we would consider. But I think that where we're at now as a practical reality, because states have legalized, and the principle that we're talking about is that if we start chasing molecules, we could be chasing our tail for quite some time. So from a federal regulatory perspective, but also a state level regulatory perspective, we've been involved in putting together standards on this. And I see some folks, some folks here today from our organization who've been extremely involved in this discussion. And the thing that we've been most looking at is the total intoxicating cannabinoid content, developing a standard around that, and having a Delta 9 equivalency that is measured of these molecules that we find out are intoxicating, right? Because if we can translate at a consumer level how it is that they're going to react to the product, we can get at a label identification and a serving size that people will reasonably know that if they're using that product, that there will be a level of intoxication that they might encounter from using one of those products. Because right now we're sort of all over the place, right? And in alcohol, look, you reasonably know, it's interesting. Probably most people here have a frame of reference about if they drank a glass of wine, if they had a shot, or they drank a beer, they might reasonably know how they react to that. With cannabis products, that's not as well known. And as we become more sort of mainstream with the product consumption, we need to create modes that will be easy to understand for the consumer and how we regulate. And if we were just regulating by cannabinoid and creating equivalencies each time on that weren't based off the regulation, I think that's sort of the recipe with how we move forward. And also, I would say this, Jillian, when you talk about regulating by molecule, when you regulate by molecule at the federal level, it becomes very different how you would regulate by molecule at the federal level than if you were regulating sort of by the cannabinoid. And I think that we're in a position where we have to, we have to make those decisions about what that marketplace looks like going forward. And I think that intoxication is that guidepost.
So let's jump in real quick with a couple of audience questions. We've gotten a couple of them, and this one just seems to strike me as perfect for this conversation. How do we regulate an industry whose train has left the station? Intoxicating hemp-derived cannabinoids account for a $2 to $5 billion business. So how do we do a clawback in a rational manner?
Yeah, I mean, I'll just jump in, but Kay, I'd love to hear from you as someone who has regulated the industry. And I mean, the reality of cannabis regulation is regulating an industry that left the station in some cases thousands of years ago, but there has been a robust market for cannabis. Cannabis was not invented when legalization happened, obviously. But that being said, there are ways, that's the goal is, we all know that prohibiting people's businesses is not a work, if there's enough money there or there's enough profit motive or people just think it's the right thing to do, you're not going to push them out of the market if you don't, you got to find pathways for them into the market. So I don't think you're going to be able just to stop intoxicating hemp products altogether. You're going to have to figure out, what are the kinds of things that we want to do? Where do we allocate enforcement dollars? Because even if, even that's part of the problem. Even, when we know that there's very clear violators of law or people that are selling intoxicating products, it's just simply not an enforcement priority because there's bigger, more important public health and safety problems, at least at this point. That all changes when a prominent politician or, wealthy person's kid gets, a product or something bad happens or there's a terrible story on the news, then the priorities go up, but it just isn't a priority. So even, that's why regulating an industry that's the train's left the station, if there's not a high amount of enforcement dollars or enforcement priorities made, it doesn't matter what laws you put into place.
Yeah.
I also go ahead, Kay.
Okay. I was going to agree with Christian. I don't think we can just say the pony's out of the barn, wave goodbye. There has to be something done to protect public health and safety. And I think that is capable of being done. And we have so many lessons learned from what the states around the nation did in terms of legalizing cannabis. And one of the things that I think is a priority is exactly what the panel has discussed today. Once you start harmonizing amongst the states in terms of testing, in terms of labels, in terms of consumer education, and making this product, the product that is regulated, safer, more desirable, and more attractive to the consumer, and get the consumer to understand what exactly it is. To Michael's point right now, there are things we already consume that intoxicate us, but we just have more understanding of how that works. And so if the regulation of the product is done in a way that acknowledges the fact that we need more information from the scientific community, we need to educate our legislators and regulators as to the various stakeholder interests that are going to be affected here. Because if there's nothing else that we've learned from regulating cannabis, is that the law of unintended consequences is very alive in this space. So we really need to ensure that we're taking everything into account as we do this. And I think it can be done. So Jillian, I'm sorry, go ahead.
No, that's fine. I'm glad you brought up harmonization because I want to put a fine point on that. There is a void of federal engagement in this space on the regulatory landscape, and state regulators need federal engagement to help with harmonization because cannabis and hemp laws are increasingly being made through state legislatures. It is not as simple as getting a group of regulators together who say, this makes sense and we should all do this. every state has to take that through their legislative process. So I think there would be a huge benefit to having more federal engagement on this to set some minimum standards that could create that harmony. The point I was going to quickly make is on the illicit market. I do think, all regulators are concerned about the illicit market. They want to capture things in the regulated market. If policies approach hemp-derived cannabinoids by banning individual cannabinoids, I do think that poses challenge for curtailing the illicit market, because then that may push some of those things into the illicit market. I think, we've seen some states, Oregon, Michigan, that have done a good job policy-wise in saying, we're going to bring these onto a regulated pathway. And before we allow them, we're going to, put the onus on the producers to create standards for, with us, standards for safety. And these products aren't going to be sold until we can tell consumers we know they're being safely manufactured. So I think, there's always a benefit for regulated markets to looking at a legalization framework that allows a pathway for the things that are out there now, provided that safety can be met. So I think that's the challenge, is without FDA, engaged at the federal level regulating, it's a lot for states to say this is what a safe regulatory pathway looks like for something like Delta 8, for example.
Well, this has been fascinating, and we're coming up on time here. And I do have one more question maybe for you, Kay. What steps do you think policymakers can take to keep up with an industry that's constantly innovating and changing?
Partly what I had just said, but I think the other thing, and I think someone brought it up in the comments as well, is the idea of engagement and legislator and regulator engagement with the communities affected by the regulations or the legislation that they're promulgating. I can just tell you, as a regulator, you are often isolated from the very people who will be affected by what you're researching and what you're trying to put out there. Opportunities to get access to the scientific community, I think, is very important when you're talking about issues such as what defines intoxication, what defines synthetic, things that are necessarily, as Jillian highlighted earlier in the webinar today, are necessarily hinging on scientific issues. And I can tell you, just having recently gone to a scientific conference, that the scientific community does not feel heard or engaged with by legislators or regulators. And I think opportunities to find bridges to different stakeholder groups to enhance the information that regulators have as they are attempting to work on these issues. And then also getting the message out there that the regulations or legislation is pending. I think that was one of the more frustrating conversations I had with scientists, was to say, well, we did a zillion public hearings and opportunities for you to pipe in on what you believed was a problem in our regulations. Where were you? And his response was simply, I didn't know it was happening. So I think, again, to go back to the original question you asked me, public education is very important, but we also need some stakeholder education in terms of how to communicate with each other and how to make sure everybody is heard sufficiently to get this to a place where we're doing it right the first time, and reflecting the various needs of the different stakeholder groups.
Great.
Well, with that,
exactly
would love for each of you to jump in with the final 60 seconds. If there's something we haven't gotten to, if you want to make a fine point on the Farm Bill, let's go ahead and start with Kay, and then Jillian and Christian, in that order. And Mike.
Well, I feel that I just gave my 60 seconds in, pushing for bridges to different stakeholder groups and more engagement amongst the various people involved, and pushing forward these very groundbreaking and, first in the nation issues that we're confronting right now. If an agency as riddled with expertise as the FDA feels the need to go back to Congress before it can fully address these issues, I think that highlights the fact these are very nuanced and complicated issues, and we really need to push forward in a group effort to find solutions that will protect the public health and safety.
And I think my closing point would be, this is a challenging issue for lawmakers and for regulators. CANRA is here to help convene discussions. States are challenged by the dual pathways that tend to exist in most states, with one agency regulating hemp and another agency regulating cannabis, and very different specifications. And I think state regulators would really benefit from more federal engagement. And that's what we would like to see, is action to empower federal agencies to get more involved with states on this issue, to help more with the science, to be more engaged in setting some of those minimum standards. I think that's essential to a thoughtful regulatory landscape in this space.
I'll piggyback off of what both Kay and Jillian just said, and maybe just emphasize the science piece. I mean, we had this in the task force in Colorado. Everyone, so many scientific experts came forward, with their opinions on things, and really PhD level people saying to me, saying to this group, if it's, as long as it's more than 5-to-1 CBD to THC, it's not intoxicating, which I'm like, I know to be patently false. So what we need to do, and unfortunately, I think, bigger picture in this country, there's, especially over COVID, a lot of people do their own research, right? And a lot of people are engaged in, I'm a scientist, but this isn't my specialty, but I'm going to weigh in, and really don't know what we're talking about. We need a validated group of experts, and we need to trust the experts on the science in particular, because, we're trying to make public policy. If you don't have that science, we're making public, it's shifting. It was a moving target, because one day it was that this is okay and this is perfectly safe. The next day, a battle of the experts were happening, and I don't even know if any of them were experts, to be honest. So I'm a big believer that we need more and more science experts that are validated and agreed to by a large group of people, that these are the people that we're going to go to.
This to me is the defining question of the industry, of where it is that we are going to go, of where it is, if we're going to see a regulated industry going forward, if we're going to take into account public health and safety, which should be paramount to any approach here. And we have to look at this the way that we look at other issues. We have to talk about, an age limit of 21 for retail sales. We need to talk about penalties for knowingly selling products to minors. We need to make sure that the products that are out there on the market are from licensed producers, and what it is that they're, what it is that they say that they do are intended to do. That's the hallmark of a regulated system. Make people meet GMP requirements on it for production standards. Manufacturers should be responsible for meeting testing standards, right? We should have the creation of federal testing standards. There should be penalties applied for unlicensed manufacturing of these products. We have to talk about both sides of the coin. We have to talk about what it's not just when we talk intoxicating or non-intoxicating. We have to talk about where the enforcement lines are on some of these things. And we can't go back to a failed past here. We have to move forward. And it's not a question of, are intoxicating products going to be available from an adult use perspective? We've moved past yes or no, in my view, from do you agree with or do you not agree with? We now need to be having the conversation of how we're regulating. And ultimately, at the end of the day, that's the guidepost. That's where I see this going. And I want to thank everybody else here who's on the panel for expressing their views on that. I found it to be a very important, informative discussion that I look forward to continuing.
Thank you so much. We appreciate each and every one of your perspectives. We're hearing standards, education, honesty and lab testing, and most importantly, working at a federal level for safe and sensible regulatory frameworks. And so thank you so much for attending this, all of the people that have sat in on this. And Jack, thank you so much for hosting. Our next webinar is going to be April 27th, and we also have a Canna Cafe that the CFCR is putting on. So we hope you'll join us. And Jack, I'm going to give it back over to you. And thank you again, everyone, for sitting in today.
Thanks
Terrific.
for having us.
Thanks, everyone. A copy of today's webinar will be posted on CFCR's YouTube, and you can see about the Canna Cafe and the next event at uscfcr.org. Thank you all, and if you've got a second, if you could fill out the viewer survey as you exit, we'd be appreciative.
Thanks, Jack.
Thanks, Jack.